Right, so we discussed about the refractory errors, in which we discussed most specifically about hyperopia, which is also called as the hypermetropia, and also we discussed about the myopia, right? अच्छा, तो उसके बाद है हमारे पास एक टॉपिक which is called as astigmatism. Astigmatism का मतलब क्या है? Let me tell you. For example, the very first thing that you have to see, this is actually the normal eye, right? This is the normal eye. This is the normal eyeball, simple. Okay, you can see here the cornea is very normal. Cornea is also normal, right? Now I will tell you okay, what happens inside the astigmatism. Listen, for example, this is the eyeball. Okay, this is the eyeball. अब यहाँ पे जो मसला होता है, that is actually the problem is with the cornea. Okay, now this cornea is like this, abnormally curved. Okay, see, now this cornea is normal, but this cornea is abnormally curved. Okay, so we can say कि here the cornea is abnormally curved. Okay, when the cornea is abnormally curved, we cannot actually see the things very clearly. For example, in the normal cornea, when the light comes, okay, when the light comes, the light focuses here. यहाँ पे एक इमेज बनता है, this is the focus point. Okay, this is the focus point of the light energy. Okay, so this is the focus point of the light energy, and only one image is formed. Okay, now what happens inside the astigmatism? In astigmatism, actually, because these cornea is very curved, okay, the cornea is curved, so one focus point will be made here, the second focus point will be made here because of the curved cornea. Okay, हो सकता है कि एक और focal point यहाँ पे बने और एक focal point यहाँ पे बने, right? So that is why these people have vision problem. Okay, see, astigmatism is the abnormal curvature of the cornea. Here that we have our cornea. This is abnormally curved. Different refractory power at different axes. So different refractory powers होते हैं at different axes. Okay, यहाँ पे भी, यहाँ पे भी, यहाँ पे भी, यहाँ पे भी. Correct with the cylindrical lenses. तो इसमें हम क्या यूज करते हैं? Cylindrical lenses as a treatment के तौर पे. Okay, and these cylindrical lenses will treat this. Okay, these patients will actually see very clearly with the help of these cylindrical lenses. So the next topic is the presbyopia. Yeah, presbyopia. What happens in the presbyopia? This is actually a lens disorder. Okay, age-related impaired accommodation or focusing on near objects. So these occurs actually with age of the patient. Okay, what happens that normally you have the lens in your eyes. I will explain, don't worry. Okay, there will be reduced elasticity of lens and reduced in contraction of the ciliary body, but mostly ciliary body इसमें intact रहता है, जो elasticity of lens है वो डैमेज होता है. Okay, अच्छा, primarily due to reduced lens elasticity, patient often need reading glasses or magnifiers. So listen very carefully. What happens in these diseases? Okay, listen. When we discuss about the presbyopia, first of all, you need to understand about the normal eye. कि normal eye के अंदर क्या होता है? Yes. So when the light energy comes from outside, okay, when the light energy comes from outside, these will focus here on the retina. Simple. Okay. Now what happens in the नॉर्मल पीपल के जैसे ही फॉर एग्जांपल वो नियर ऑब्जेक्ट्स को देखते हैं, नियर ऑब्जेक्ट्स को जब देखते हैं, इनका जो ये लेंस, ये जो आपको नज़र आ रहा है, दिस इज कॉल्ड एज द लेंस. ओके, विच आर अटैच्ड विद द सिलियरी बॉडीज, एंड सिलियरी बॉडीज आर ऑब्वियसली अ पार्ट ऑफ द कोरोइड. ओके, अच्छा, तो अब क्या है कि ये जो लेंस है, जैसे ही आप नियर ऑब्जेक्ट्स को देखते हो ना, व्हेन यू सी और व्हेन यू लुक एट द नियर ऑब्जेक्ट्स, these lens will become globular in shape. Okay, these lens will become globular in shape. क्यों ग्लोब्यूलर होता है? ताकि आप अच्छे से फोकस करो. ओके, ताकि आपका अच्छे से फोकस हो ऑन द नियर ऑब्जेक्ट्स. इसीलिए ये जो लेंस है, ये these becomes globular in shape. Okay, and when you look at the far things, okay, when you look at the far things, these lens will become flat. These lens will become flat. Okay, क्यों फ्लैट बनता है? इसीलिए ताकि आप जो है दूर ऑब्जेक्ट्स को देख सको, ताकि आपकी आंखों के अंदर ज़्यादा रोशनी आ जाए और आप दूर ऑब्जेक्ट्स को देख सको आसानी से. ओके, फाइन. सो व्हेन यू लुक एट द फार थिंग्स, योर लेंस विल बिकम फ्लैट, एंड व्हेन यू विल लुक एट द नियर थिंग्स, योर लेंस विल बिकम ग्लोबुलर. सिंपल. दिस इज व्हाट हैपेंस इन द नॉर्मल पीपल. नाउ व्हाट हैपेंस इन द presbyopia? Listen, when we discuss about the presbyopia, again, this is our eye, and this is actually our lens. This is our lens, understood? Okay, what happens with the lens? What happens with the lens, these lens become very stiff, okay, and it cannot accommodate. So in short we can say it cannot accommodate. Accommodate, why? What is the reason? Because normally with time ये जो लेंस है इसके अंदर नॉर्मली क्या होता है, पानी होता है, राइट, और ये पानी आहिस्ता आहिस्ता से ख़त्म होता जाता है, ओके, ड्यू टू लैक ऑफ वाटर। आहिस्ता आहिस्ता से जब इसके अंदर पानी ख़त्म होता है, सो दीज लेंस विल बिकम वेरी वेरी स्टिफ, ओके। हमारे जो सिलियरी बॉडीज होते हैं दे आर परफेक्टली फाइन, ओके, द सिलियरी बॉडीज आर फाइन, बट द प्रॉब्लम इज, द रियल प्रॉब्लम इज विद द लेंस, these lens cannot become globular. So I will write down here, the lens cannot become globular. Lens cannot become globular. Right? This is the main problem with that, right? तो इसीलिए ये जो पेशेंट्स होते हैं, आपको पता है, शायद आपने देखा होगा, ये जो फॉर एग्जांपल अखबार वगैरह पढ़ते हैं तो अखबार को कोशिश करते हैं ये थोड़ा सा अपने आंखों से दूर रखे, राइट, उसके बाद फिर इनको अच्छे से नज़र आता है एंड देन दे विल रीड द न्यूज़पेपर, ओके। सो दिस इज़ व्हाट हैपेंस इन द प्रेस बायोपिया। अच्छा, अब इस कंडीशन को हम ठीक कैसे करते हैं? Mostly it is actually age related, okay, and impaired accommodation or focusing on the near objects, so primarily due to reduced lens elasticity, and the patient often need reading glasses or magnifiers. So this is the treatment for this, okay. Let's highlight this. They often need the reading glasses or the magnifiers.